Hi, Mrs. H. It's good to see you.
Hi, Dr. Gray. Yeah, it's likewise good to see you too.
Okay. Now, I've asked you to come today to talk to you about your high cholesterol. Okay, the last time we spoke, we talked about diet and exercise. Can you tell me how you've been going with that?
Oh, not too good. I probably only just started to get serious probably about 10 days ago. So, yeah.
That may explain the recent test results, which show that your cholesterol levels are still quite high. They're at 7.2. Your LDL came back above 5.5, and we'd like to keep it at about 4. This is because you have several risk factors, one being that you are over the age of 45. Secondly, you have a family history. Your father had some heart problems after the age of 50. And thirdly, you have high blood pressure and you smoke, which means that over the next 10 years, your chance of developing stroke or heart disease is about 20%, which means people in your circumstances, 1 in 5 will develop a stroke or heart disease.
Yeah, that sounds pretty serious. Yeah.
Well, it is serious, only if we don't lower your cholesterol levels effectively, because you do have other risk factors such as smoking.
I know, but I just smoke because I don't want to put on weight. And I was like five years ago, I just put on so much weight.
Okay, well, we can discuss this next time you come see me. Okay?
Yeah. Okay.
Great. As to your cholesterol levels, I'd like for you to help me decide which medication would be best for you.
So, is this something that I'd have to take for the rest of my life?
Yes, for it to be effective, you'd need to take this medication every day. Is that okay with you?
Yep, okay.
All right. Well, I'd like to discuss 3 possible medications that I'd like you to take.
Mm-hmm. Okay.
The first drug that I'd like to discuss with you is called Lipitor. It has some great evidence that it can reduce your cholesterol levels by 50 to 60%. As with any other medications, there are side effects to taking Lipitor. A very serious side effect is a muscle disease. It's very rare and it can happen in about 1% of the people on Lipitor. But there are also some others, such as a headache. You can develop headaches, and also some liver problems. So you can get liver inflammation called hepatitis. We can monitor this with taking blood tests for both muscle disease and liver disease. So we would take some blood, check your liver functions, and make sure that we have a baseline, and then we would take your blood again in 6 weeks to see how you were going after you would take, say, Lipitor. Also, we would periodically measure your blood levels just to make sure that there's no underlying liver pathology or some muscle disease. Okay? So I would give you a script today. You would be taking the medications at night with meals, because that's the best time to take them. Okay? So I would need you to tell me if you're having any muscle pain, and then you would have to come back and see me. But as I said before, it's very rare. Okay?
So what are the options?
Okay, the other option is a drug called cholestyramine. It has some problems. People don't like to take it because it can be troublesome. You have to take it several times a day. It can have a side effect of constipation. Okay. The other drug is a drug called niacin, and it also has some side effects. You could develop some flushing, so you'd feel very hot. There's also some palpitations, so you would get an increased heart rate, and this can actually scare people when they take the medication. Okay. Now I know I've given you a lot of information, but what do you think?
Yeah, there is a lot of information to digest. Now I feel as though I'll go with the Lipitor.
Okay.
Because of my father with the heart disease. I will go with the Lipitor because it's once a day. And I guess, does this really prevent heart attacks?
Yes, absolutely. There's some good research out there that shows that it can reduce the first heart attack in people in your age group. There's also the problem that we can never predict that you, or prevent 100% that you'll never get a heart attack. But if we effectively lower your cholesterol, that will reduce your chances. Okay? So I know that I've given you a lot of information and this may be very overwhelming, but if you have any questions that come up in the future, you can come back and talk to me, okay?
Thank you. Yeah.
Okay, great. I also have this handout here for you. It's basically shows or talks about everything that we have discussed. So in the future, if you have any things that you need to clear up, or you read through this and you have any further questions, you can come back and see me.
Okay, lovely, thank you. And
Okay.
I can take this away with
You can take that away with you, that's right.
Lovely.
Okay. So basically, why don't you just tell me in your words what you think will happen from today?
Apart from reading this, I will have a blood test.
Yep.
And I will go and get the script filled.
Yep.
And I will, oh dearie me, I will start the medication tonight with my dinner time or with the meal, and I'll see you in 6 weeks' time.
Okay, excellent, that's great. And if you develop any muscle pain, you can come back and see me and we can reevaluate the situation.
Great, thank you.
Okay,
Thanks,
thank you,
Doctor.
that's
Thank
great.
you.